Bill Daughtry back on New York Sports and Beyond on ESPN New York 98.7 FM. September is Prostate Cancer Awareness Month, something that all men should be very aware of. Dr. Deepak Kapoor from the Advanced Urology Center here in New York City joining me on the program to talk about this important subject. Dr. Kapoor, thank you and welcome to the show.
Well, Bill, first let me thank you for having me on here to bring attention to your listeners and help educate people on this important subject.
Now, 1 in 7 men, as I understand it, will be diagnosed with prostate cancer during their lifetime. And despite early detection and treatment, one man dies every 30 minutes from this disease. All New Yorkers, particularly all New York sports fans, remember the situation with Joe Torre a few years back when he was manager of the New York Yankees. A basic test showed elevated PSAs, and the rest, as they say, is history. In his case, all good.
Well, that's correct, and Joe Torre is an example of how early detection saves lives. You know, Bill, one of the real tragedies is that right now there's so much misinformation and misconception surrounding screening for prostate cancer. Regrettably, a government agency put out a recommendation a few years ago recommending against routine PSA screening, and that unfortunately was based on a misinterpretation of existing literature. The most recently published information is rock solid. Early detection of prostate cancer saves lives. In fact, the largest study that's ever been done shows that for all men that get screened, having early detection reduces death from prostate cancer by 20%. And even more importantly, if you start screening before age 60, there's a 50% reduction in mortality from this disease.
Dr. Kapoor, I gave some numbers a moment ago. 1 in 7 men will be diagnosed during his lifetime, and one dies every 30 minutes. And these numbers are even higher if you are an African American or if you have a family history of prostate cancer. I'm curious, has there been any research as to why the numbers are higher for African American men?
There seems to be a very strong genetic predisposition. We don't really understand what the genetic predisposition is, but we know that it runs in families. So that's why men that have a first-degree male relative, a father, a brother, a paternal uncle, are at much higher risk of having this disease. And also African-American men, particularly African-American men of Caribbean descent, have a much higher incidence of prostate cancer than the population as a whole. Unfortunately, also, particularly with African Americans, there's a lot of resistance in getting tested for prostate cancer. And this is a community that really needs special outreach because it's very important that we overcome our resistance to getting checked as men and get early detection. Prostate cancer is the most commonly diagnosed solid tumor in men and is still, despite all our advances, the second leading cause of cancer death. So there's no question that the vast majority of those men that died, had we caught their disease early with modern technology, we would have been able to cure them, and that's the real tragedy.
Bill Daughtry with Dr. Deepak Kapoor calling attention to September being Prostate Cancer Awareness Month. You talk about men and their disdain for the examination. I believe we're talking about the digital examination, but there is also PSA testing, if I'm not mistaken. Correct, doctor?
That's correct. I mean, a thorough prostate screening involves both a blood test and the digital rectal exam. And nobody likes having examinations done, but our compatriots on the other side of the gender table, women, understand the importance of going to their gynecologist and getting their pap smears for cervical cancer and getting checked on a regular basis. And so one of the things is I implore all the women's sports fans that are listening to your show to encourage their fathers and their husbands and their sons, if need be, all the men in their lives. One of the things that we find really motivates men to go is when their partners really encourage them to be there, because sports is really something that families can share together, and we want to make sure that the fathers are there to be part of these traditions for years to come.
And of course, doctor, if you are an African American or have a family history, you should start getting screened around 40. If you're not in either one of those brackets, when do men generally start to need to get tested?
Well, that's a great question, Bill, and probably the most important point that we'll make is that we've adopted a much more nuanced approach to cancer screening. So what the current recommendations are is that for all men, regardless of risk, to get a baseline PSA test sometime in their 40s. And based on the results of that baseline PSA test, taken in consideration with other risk factors, then people can talk with their doctors and talk about the most appropriate interval. So, for example, if you are in a low-risk category and have a very low baseline PSA, you may not need another checkup for 5 years. On the other hand, if your PSA is borderline and you have a high risk, maybe you're going to need to be checked every 12 months or possibly even more often than that. So there's not really a one-size-fits-all approach to this. It's really important that men talk to their healthcare providers and determine what the appropriate interval is for their testing, and by all means, get a baseline PSA done in their 40s.
Dr. Kapoor, tell me, if you would, about advanced urology centers and how people can get in touch with you if they feel the need or have this concern.
Well, Advanced Urology Centers of New York is the largest provider of urological services in the United States. We do just under 20% of urology in the state of New York and about 1.5% of all the urology in the country. We're also particularly proud to be a clinical affiliate of the Mount Sinai Hospital, so we have the resources of a world-class research institution at our disposal as well. So information on screening is available. There'll be screenings all over the New York metro area during the month of September that are free. Listeners can go to our website. That's www.aucofny.com, or simply go just look up prostate cancer screening in their browser and find the one that's closest to them.
It's a very simple process. It does not take long, and it could add years to your life or to the life of a loved one. So, by all means, heed the doctor's admonishment. Get checked, because prostate cancer is nothing to mess with, and September is Prostate Cancer Awareness Month. Dr. Kapoor, thank you for the time and the information.
And thank you again. And remember, everybody out there, early detection saves lives.